Hi everyone, Dr. Kate ND here with you in the next continuation of our life-saving series. So, what we're going to be talking about is the techniques for once you actually get into CPR. So how to do CPR and what your body's doing and how to do it. So if you have gone through scene survey, you've determined responsiveness, you've checked their ABCs, they're not breathing, then you know for sure you have to get into CPR. So what you're going to do with that, when you're setting up, so let's say the person's arm is here, you're going to go to their armpit crease. So the typical theory is that you want to be in line with the nipple in the center of the chest, which is not perfect. So armpit crease, go to the middle of the chest, then you're on that bone there, you're on the breastbone or the sternum. That's where you want to landmark, because essentially with each compression, remember that we are compressing the heart, okay? Now usually there's a bag in here so that it's reflective of the lungs, and every time you breathe in, this raises. However, in COVID times, we took that off because no one is actually putting their mouth on the avatars or anything. So hand position, pretend there's an arm here, you're doing armpit crease, come to the center, and you're using the heel of your hand, essentially, on that center spot. And then you can either overlap your hands so that they're like this way, or if you have an injury, you can reinforce your wrist as well. So you choose your method, again, whatever works for you. Your arms are going to be straight, so they're not fully locked out as if they're kind of hyperextended. They do have a slight bend so that your joints are protected. But the action of the compression itself is not coming from your arms at all. So you're not pushing with your arms. You're actually using your body weight to come down and do the compression. So how that looks from the side is I set up here, I have my person's arm, I do the armpit crease, heel on my hand, and then my hands are overlapping or interlocked or reinforced. And then I'm using my body weight to come down and do my compressions. Now, the rate that you're aiming for with the compressions is 2 compressions per second. And that's fairly quick, right? And then you're going to do 2 breaths. So 30 to 2, 30 compressions, 2 breaths. That's the rate that we're going for. And then the other thing to remember is how many cycles you've been through. So how many compressions and breaths, how many sets, if you will, have you gone through? Because when EMS arrives, that's what they're going to ask you. So the way that I keep track is I look at the head, arm, leg, arm. And I know that once I've made it 1 full cycle around the body, that's 5 cycles. And 5 cycles equates to approximately 2 minutes. Okay, so that helps you judge out the time. So if I'm setting up here, I've got armpit crease to the center, heel of the hand, hands are overlapped. And then if I'm doing two compressions per second, I'm going to count it out with you guys for 1 cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now for the breaths, the actors have a flat spot on the back of their head, so the head tilt chin lift is quite easy. So looking at it from this angle, head tilt, chin lift, that's opening the airway if you'll remember from the ABC check. Now you're going to plug the nose because you don't want air to escape that way, and you're going to do your breaths. How much air are you putting in? Just enough to have the chest rise and fall. If you meet resistance, do the head tilt chin lift again, plug the nose, and try again. If your breaths are not successful, don't worry. Get right back into your compressions, okay? So if I'm doing compressions for an adult, as I say, that's the 2-hand. If it's a child, now it's 1 hand. So that looks exactly the same. You're landmarking armpit crease to the center. Now you're using 1 hand. And as I say, if you have an injury, do reinforce it. Otherwise, you can be like this. And same compressions to breath, so 30. We're going to do that together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, chin lift, plug the nose, same as for the adults. Breath in, 2 breaths. Okay, so adult and child compressions are the same, only child you're using one hand. And a child is considered a 1-year-old to an 8-year-old. Anyone above 8 is considered an adult. But again, bear in mind, if you have a small rescuer and a larger victim, you may need to use both arms, and that is totally fine. All right, guys, hope you enjoyed, and stay tuned for the CPR for infants.